guys, and welcome back to another episode of Next to Madison. On today's episode, I'm sitting down with an emergency room doctor out of Massachusetts who is going to talk about COVID-19, what his experience was with it, and also kind of where we're headed medically and kind of what's going on and what we're being told in the media versus what's going on in the hospitals, and different questions that we all kind of want to know, and what's going to happen next. Is there going to be a second wave? Are we prepared? So very important interview. And with that being said, I'm going to go ahead and bring on my guest, who I'm so honored that he's sitting down with me and taking time out of his busy schedule. So I would like to welcome Dr. Teri Ciccone. How are you?
I'm doing great, Madison. How are you?
I am good. So tell us about this whole, let's kind of start back when the whole COVID thing really kind of peaked up in March and we went on a lockdown. How was it up in Massachusetts for you guys?
Right, yeah. So in our kind of preparation for it, there was some lead up and some preparation that started in February, but as you said, March is when things really started to change rapidly. Massachusetts has been one of the top 5 states with both cases and deaths throughout this. We were number 3 for a while. I think we may have in the past few days been surpassed, but to say we had a lot of it here, and we did see a lot of it in my hospital. Those first few weeks of March, there was a lot of, as with everyone, there was a lot of uncertainty among healthcare professionals. We really didn't know the best way to get ready for this. How were we going to test? What were the criteria for that? How are we going to protect ourselves? How would we just operate our emergency department to keep people away, isolate? How are we going to intubate people to put them on the ventilator? The actual process of doing that exposes you to a lot of aerosol particles, so that kind of puts you at higher risk. So it was a really nerve-wracking time, really challenging, literally by the day criteria for who to test, how to do the test. It was changing so rapidly, and a lot of that decision making and changing criteria was unfortunately the result of a low swabs or low assay, the test kit assays and such like that. So there were times where we were deciding who to test or not necessarily based on what was medically making the most sense, but just the availability of equipment. The same thing went for PPE. My hospital and our state in general, they generally did a very good job of protecting us, and I have felt protected. But man, the rules are different, and a lot of the things I learned I've been doing emergency medicine for 15 years. When I was in med school and residency, what we were taught about hygiene and sanitation and how to glove and gown and mask and everything always went in the trash after you used it with one patient. And then come one day you said, actually, you're going to use that mask all day. And then the next week, it's actually, you're going to use that mask for 3 shifts. And then a week later, actually, you're going to use the mask for 3 shifts. We're going to take it back. We're going to fog it with hydrogen peroxide and give it back to you. And then you're going to wear it for another 3 shifts. So that was very hard for me to get around because it went against everything we learned. But it's the reality. It seems to be working. In my department, none of the providers, knock on wood, have gotten ill. 3 of the nurses have, out of a staff of probably like 60 or 70. None of them, significant, none of them had to be, they just went home for 2 weeks and then came back and, I'm fine, But definitely those first few weeks were challenging. And then the surge came and it got scary for a while there. As we know with this virus, most people are fine, but the people who get really sick can get really sick really fast. by far the majority of those were your older nursing home patients, patients with comorbid conditions, diabetes, COPD, but there were, it was really mid-April, a few weeks there where every shift it's like, boom, they're coming, boom, the nursing home's calling, boom, 30 patients in a nursing home, 3 of them coming to the hospital, but so far so good. We managed to keep ourselves safe. There's been a huge tragedy with, people who have gotten sick with this really severely and passed away, but I think we came out on the other, sort of on the other end so far, okay.
Okay, and do you think that the government did the right thing by shutting everything down?
I do, and that was different state. There was an overall kind of federal suggestion to do it. I'm not really sure the federal government has authority to kind of mandate that, but it went state by state.
Mm-hmm.
And just speaking for Massachusetts, Governor Baker here was a little bit later in the non-essential business shutdown, but maybe by I don't know, I thought he could have pulled the trigger 3-4 days earlier. But we did. We're in phase 1 recovery. Things are, non-essential businesses are starting to reopen. I will say on the shutdown, I do think it saved lives, which is the most critical thing. From my end, what was really important is that it prevented the hospitals from getting overrun. We've all seen some of the, really kind of bad weeks they had in Italy, New York City, some other places, Detroit, New Orleans, had a few days or weeks where the hospitals got bananas. We fortunately did not see that in Massachusetts. There was no point ever where, someone, passing away in a hallway just because they couldn't get an oxygen tank. There was never anything like that. Which, the more and more we hear about what was going on in Wuhan, in December when that really got bad. I mean, a lot of their deaths were preventable in the way that people just couldn't get access to what they needed. So I do think the shutdown of non-essential businesses and the general stay-at-home order, I do think saved lives and definitely prevented the hospitals from getting overwhelmed. I don't know how, in the end, when the dust from this all settles, how you're going to quantify that. And I do think it's hard to say we could have saved 5,000 more lives if we had shut 2 days earlier or a week earlier. I'm not really certain that we ever have statistical methods that can really tell you that. But I think the overall trend was it was a good thing.
Okay. And so when you would get home from your shifts and you would turn on the news, how did you feel the media's portrayal of this crisis was? Because they were just reporting what they were hearing, and we don't know if it's the truth. We still don't know what was going on. So what was your interpretation of that?
Yeah, me and my wife set a little rule about the media exposure during the height of this, and that was we watch one of our local news stations, one of the Boston stations every day. And then when I got home, I could veto, and I could say, what, we're not doing the news today. But we usually did. And we then had an hour limit. And then we watch something else, go to bed, whatever. So the media portrayal, as everyone's aware, is vastly different depending on what source you get your news from. Yeah. And it was my practice, and usually has been in the past, to try to get my information from a number of sources, not to get locked in on any one. Mm-hmm. That's what I teach my kids, and I think is a good kind of lesson for people in general. Because if you just get your news from one source, then you can get caught up in a dogma and a way of thought where you may have never even been exposed to the other side of the thought. Yeah. So I think it's important. So yes, some media outlets overblew it. Some played it down, largely for their political purposes and such like that. And I think if you get your media, or get your information from a few different sources in small doses, or not overwhelming doses, and form your own opinion. That's the most important thing people can do, I think, during any crisis, whether it's COVID or,
Yeah.
just a completely separate economic crisis, whether it's, war or, international crises. Get the information from different places, take a step back, think, and then make your own opinion and act on what you think's right.
Because so much of this, I think at first people were very scared. I mean, we learned that the media can put the fear of God in you. And then as the numbers started changing and the opinions were wrong and the models were wrong and everything was like just not matching up, news sources were very different. People were starting to go, COVID-19 started to feel more political. Did you get that sense and that feeling at all?
Absolutely. Absolutely. And, taking this away from the medical side of things, I mean, we've become a politically polarized nation on any topic. And the more critical, the bigger deal topic A, B, or C is, the further to the sides people run, right and left. So absolutely, I think politics has played a large part in the national focus. It's been less so locally for me here in Massachusetts, but it's been a big part of it. Now, what you hope with that, though, and what I think I think they've done a decent job, is to create your policies as much as possible based on the science and the medicine, as opposed to the politics. And as we start to reopen, we're going to see more of this. Masks here, masks not here. You can sit inside in this restaurant in this state, but not in another state. And ultimately it's you or someone else or my own decision if I go to a restaurant. I don't think you'd have to be literally under a rock for months to not know that this thing is out there, and you could get sick from it. And most people are fine, but some people get very sick. And ultimately, it's going to be a personal decision, and that's the most important thing. The wide-scale shutdowns and restrictions are not necessarily meant to protect you or me. They're to protect you from me. All right, and that's a little bit different way to kind of look at things, a way to frame it.
Yeah.
I use the example of with the masks, like should they be, mandatory or not? In Massachusetts, you do. I assume most states, to drive a car, you need to have working headlights, right?
Yeah.
Okay. Now that keeps you safe on the one hand because you can see where you're driving. But it also keeps other drivers safe who are merging into traffic at night, or someone you're pulling up behind and passing on the highway. So that's the type of thing where, as a society, we don't even think about that. We just accept that it's a rule that you have headlights on your car. It keeps you safe, but it more importantly also keeps the other person safe. And I'd almost like to think of the mask thing that way. And if it does continue to prove, or if there is evidence that continues to show that transmission is decreased in places where there's more mask use, well, then maybe it's just, the way it should be. And also, kind of similarly with the, no shirt, no shoes, no service, like you can't walk into a store without a shirt, and we just say that.
So you think that this mask thing might not end? Because it's really creeping me out.
I think I'll say this, whether there's a mandate, a law, a suggestion, whatever it is, I think going forward, a lot of people, and not just your complete like nervous Nelly germaphobes, I think a lot of people are just going to be doing it. And it may become the new norm for a while. And we talked about how I was talking with my wife the other day, how like times of crisis create a new norm. And we were talking about travel and how much travel changed after 9/11, Like I live up in New England here. You used to be able to drive to Canada, just your driver's license, now go ahead. The airports, everything was quicker. There wasn't as much screening, real IDs, passports didn't take, a zillion years to get unless you paid a ton for it. So, and then 9/11 happened. And then all these travel restrictions were, you'd say, probably appropriately implemented. And it may have scaled down a little bit, but by and large, our experience in travel is completely different than it was before that crisis.
Completely.
So the question is, what is our experience out in the world after this crisis? It may look very different, and maybe for a long time. And you know what, the other part that is kind of the monkey in the room, and people talk about whether there's going to be like a resurgence in the fall. I think there will be. I don't know how bad. I'm not an expert on it. I know we'll be more ready for it, both the medical system and as a society. So that's good. But not only that, but these novel viruses, there's been a couple here in this century, and before this one, we were by and large spared by SARS and MERS. We had trouble with, bird flu and such like that. But as the population of our world gets bigger, and as international travel, at least up until now, we're, with not just people, but with goods and services moving all over the world at lightning speed, there may be the next novel virus 5 years from now. And it may be another coronavirus, it may be a different kind of virus, but it may be a mutation of Ebola or whatever. But I think unfortunately, as a society going forward for the foreseeable future, we have to be prepared both from like a medical material standpoint, but also from like a mental and physical well-being standpoint, that this may keep happening. I mean, look, there have been periods of time in the world, middle-aged Europe, where it was just every 5-10 years there'd be a war, war after war, and for centuries, the people that lived during that time that's how it was. And, man, do I have to worry tomorrow that I'm going to get raided by Vikings or, whatever. And that's the life they lived. And this may be the beginning of a new life we live. I'm sorry to scare you, Madison.
Well, it's just like, the most important accessory you could ever have or wear is a smile.
I like that.
And we're taking that away. So I understand having the mask when there is an outbreak of some sort, but the flu kills roughly 80,000 people a year, but we don't shut down.
Yeah, it may be more. Yeah, that's true. And that's the other perspective. Like now the per case, a lot more people get the flu. So the per case mortality for corona is much higher than the flu.
Okay.
But yeah, you're right. People do die of the flu in large numbers. But aside from just an overall higher per case mortality, the flu we have an immunization for. And a lot of the deaths from the flu are people who choose not to get immunized, and that's their business if they do.
Yeah.
And the other thing is there is a treatment for the flu. There's the antiviral medicines like Tamiflu, which aren't an outright cure, and no doubt people who take Tamiflu can still die of the flu. But if you take it within 48 hours of the onset of symptoms, it can reduce the severity and shorten the course of the illness. So there's no treatment, no proven treatment yet for COVID, and there's no immunization. So those are some of the things that kind of make it a little different, but it is a way to look at it compared to the flu.
Okay, so let's talk about the whole debate that's been going on around hydroxychloroquine. And some people saying it is amazing, it's great, we can't get it for our patients because the government has stepped in and, interfered with what we can do. And so what's going on there?
So as with whenever there's kind of a new health crisis, there's expectedly a rush, both among the healthcare system and patients to find something that works. So hydroxychloroquine is It's an old drug. It's been around for a long time to treat malaria and certain autoimmune and rheumatologic diseases like lupus, rheumatoid arthritis, and such. And there was some, it was actually the first SARS epidemic back in 08 or 09, it was about 10 years ago, that there was some thought to using it and that it might be helpful. From what I've seen, look, the role of a doctor is with their patient, you're my patient, is to advise you what your risks and benefits of any treatment, whether it's taking a drug or wearing a cast if you break your leg or something, and then tell you that here's what I recommend. But ultimately we can have a discussion about what you want. So my end of thing with hydroxychloroquine is I never saw enough evidence to say that it did anything, either in an outpatient, like prescription setting, or in an inpatient, like hospitalized patient setting. Some of the studies that did say it was beneficial were small. And a bigger one just came out in The Lancet, which is a British medical journal, last week. And they actually they had a sample size from 6 continents worth of hospitals, 96,000 patients. Now, they were all inpatients, so these are all people admitted with COVID. So that's a sicker bunch anyways. Okay. But what they found was that there was a slightly increased risk of death in the people who took hydroxychloroquine, or they looked at chloroquine too, which is the older kind of cousin of hydroxychloroquine. So, so that, again, that's just inpatients. It didn't say anything about prophylaxis or anything. But to me, there's some evidence of potential harm. It increases your risk of dying if you're hospitalized. Okay. And I haven't seen convincing evidence of benefit. So my advice would be, there's this drug. Some smaller studies have said it's beneficial. Some larger studies have said it's harmful. My general recommendation would be to not recommend it. And the whole thing with, states prohibiting doctors from prescribing medications. I mean, we prescribe medicine off label for everything all the time. It's a common practice. And I don't think that should be happening.
I just felt that drug became so politicized. Mm-hmm. It was like this constant fight between Democrats and Republicans.
Right.
And that's when I just was like, no, this is crazy. Like, take your politics out of it. Like, we're talking about like human lives here. And, I have some people that I know who have taken it and it saved their life. And so, it's between the doctor and the patient. But I guess in different states, they were preventing, I think in Texas, there were some doctors that couldn't write the prescription for their patient. They had to get it in the hospital. And like Tamiflu, it had to be taken earlier, but I just felt it was so politicized that it made me sick. And it was like, hold up. If this might be working, every drug has a side effect, right? Even a leave that you take.
Oh yeah.
And all of a sudden it was about the political parties and like some hidden agenda.
Sure.
And it was so sickening. This whole COVID thing is like so traumatizing because it's like we lost all these people, but yet our leaders are making them it about their agendas. And then
that's politics. That's why I'm in medicine. I like this end better.
I'm telling you, if you're a politician, I don't have words to explain you. It's just everything's been so heightened. But then they came with remdesivir, which is a new drug, which is a lot more expensive.
Yeah. So remdesivir, so that was an antiviral drug that they were hoping, I forget if it was either developed for SARS-1 or for Ebola, but that may still have promise, as with a lot of newer drugs. So hydroxychloroquine is old. It's probably a wholesale cost of pennies per pill. Remdesivir is thousands of dollars per, treatment course. The limiting thing with remdesivir as well, it is intravenous. There's no pill. So again, it can only really be given to hospitalized patients. I mean, under extreme circumstances, there's ways outpatients can get IV therapy, but it is intravenous. It is expensive. The same with hydroxychloroquine. There's some smaller studies that are showing benefit. There's other studies that are not showing as much benefit. It needs to be studied more. People get frustrated with like the pace of advancement in medical sciences, and this virus has really been around for like 6 months, right? So there's these diseases we've been treating since antiquity that we know a lot more about than this one. And the pace of things does need to step up as far as the medical research, and like a lot more resources need to be brought to bear on this now. But at the same time, there's cases, there's circumstances in history where, treatments that weren't kind of thoroughly vetted, 20 years later, you end up finding out that, it caused a lot of harm. So it's a balance. It's like with the mask or the social distancing. You have to balance the potential benefit with the potential risk. We do that every day, whether even before COVID. I mean, you walk out of your door, you could be in a car accident, get hit by a bus. I mean, our life is constant risk-benefit decisions, and we have to take each one in stride, use our own best judgment, listen to advice from people, different sides, and people who you may think are reasonable with that advice, and then make your own decision.
So I want to talk about, there's a rush to get a vaccine to the market. Mm-hmm. What are your thoughts on this, and will you be taking it?
Vaccines are tricky. So the normal course to create a vaccine for any disease is usually like years, unfortunately.
Yeah.
I believe with all the resources being brought to bear, it potentially can happen sooner. I'm not going to give you a number. I really have no idea. But I definitely think it's important to do that. There's a lot of coronaviruses. Most of them just cause the cold. And there's never been a vaccine for the cold. It may have just been that no one really wanted to spend billions of dollars to figure it out, because what's so bad about a cold and why bother vaccinating people for it? But different viruses in particular can be more challenging to make a vaccine to. And as I understand that coronaviruses may be that case. I mean, if we look at HIV, it's been around for 40 years. They've been working for a vaccine on that and still nothing. And that's because the HIV virus mutates so quickly, you can't pin down like one thing to make an antigen so that you make antibodies to it. Now, that being said, HIV now, if what we know about it, there's treatment that makes it, people who have HIV and who take their medicines right and live healthy lifestyles, it's like being diabetic. I mean, it's a health problem you have, but, down the road, it's probably going to be heart disease or cancer, the same thing that offs most of us,
Yeah.
So, but just to illustrate the challenge that they're still trying to get a vaccine for HIV,
right.
Which would especially be huge in the third world, where the price of the HIV drugs, mostly in sub-Saharan Africa and Southeast Asia, it's not tenable for most people. So we'll see what plays out with the vaccine with this. As far as would I take it, I would. So in general, with vaccines, the first thing they test, even before they really see if it works, is side effect profile, safety, such like that. As with any drug, anything that has an effect can have a side effect. Okay.
Yeah.
Drugs, vaccines, you are basically putting either a chemical or a protein into your body that doesn't belong there, right? Remdesivir, hydroxychloroquine, the vaccine to the flu, those aren't things that are in my body. You take apart, take aside like vitamins and supplements. I mean, obviously there's vitamin C and magnesium in me and such like that, but you're introducing a chemical into your body, hopefully for a beneficial effect. There can always be a side effect. So, every year I get the flu vaccine. I know I have a 1 in, million chance of getting Guillain-Barré syndrome. But in my mind, my risk with what I do of catching the flu and having a complication of it is higher than that.
Yeah.
So I do the vaccine. And it would probably be the same thing with this. And the one other thing to mention, the most likely side effect, and it's not even really a side effect of vaccines, is usually not that it does something bad to you. It's just that it doesn't work. It doesn't protect you from the coronavirus.
Okay.
In which case, you may have people getting the vaccine and not really getting like medical side effects, be like, yep, I'm good, let's do this. I don't need the mask, I'm gonna, do whatever. And then if you find out a few months later, all these people that got vaccinated are now getting sick,
Right.
yeah. And now even with the flu, and just with the flu vaccine, people who get it, you can still get the flu, but they tend to get it like less severe, less complicated cases. And that may end up being the same with the COVID. It may not protect you completely, which some vaccines do, like, tetanus or something, but it may give you some protection. There's been a lot of question about whether previous infection gives you immunity. And I think it's partial. I don't think it's complete. I don't think if you've had COVID-19, you can never get it again. I just think that next time you get it, it's going to be less severe.
So, what is your thoughts on Bill Gates being so involved in vaccines and trying to really kind of pump his head into the medical world when he can't even fix a virus on a computer? This, because everyone's like, he's not a doctor. What is going on? Why is he so involved?
I actually am not too familiar with the degree to which he is involved. I know his foundation, which has been around for a while, is involved in vaccinations. I'm sorry, I can't really say why, other than it comes off as a charitable. He made a boatload of money, and this is what really through American history. I mean, there's been a lot of great philanthropy from Carnegie Mellon and building universities and hospitals and libraries and such like that. And maybe he thinks this is his contribution. To what degree he's involved in the day-to-day management or the medical end of that things, I'm not sure. What I would hope is that he's hired or working with the best scientists and virologists and clinicians and kind of supplying them the resources, but then telling them what to do. Because anything more nefarious than that, I really am not sure.
Yeah, because he's, has come to light, and kind of just the negative things about him have come. And yeah, he's done a lot of great for the world, but there's a lot of negative reports out there too. And I can't even get into it because it kind of makes my stomach turn a little bit, but it's like, why is he so interested in this? Why does he want to vaccinate? Why does he want to control the population? Like, I get.
What are your fears on that?
I just feel like it's a control thing. It's a control and a power thing, and it kind of goes back to the politics side of it. I don't know if it's for the benefit of a human being. But again, like, I'm trying to get my hands on all this different research because you don't know what to believe. And usually the biggest scumbags actually hide behind charitable contributions sometimes to kind of offset it. So I don't know enough to sit here and say, okay, Bill Gates is a complete piece of shit, or he's a really great guy. I don't know, but it's interesting. I wanted to see if you had an opinion on it, being a medical person. Like, why are you involved in this?
Well, and from your end of things, I mean, your own concerns, you can always choose to not get the vaccine.
Exactly. Well, that's why I always said, if Bill Gates does it, I'm not getting it.
Yeah, and that's your choice, and hopefully that choice is made, with your doctor or healthcare provider. Yeah. This is the risk, and this is the benefit. As far as a more, kind of nefarious, like, population control thing, that seems a little bit far-fetched to me, just simply by the fact that people don't have to get what you're trying to control with. So anyway.
Yeah, because at first the news media, some of the channels were saying, oh, and everyone, we can't open until there's a mandatory vaccine. And that is when I think people were like, whoa, most people don't even get the flu shot. Like, what
Yeah.
do you mean mandatory vaccine? So there's just so much information going on. That's why I wanted to sit down with professionals that can talk about this to like
Yeah.
get an unbiased opinion.
Yeah.
You
And
don't
if you're feeling there's something that you don't want to put in your body, I mean, I don't think that you need to be mandated to do that.
Yeah, right, exactly. So they kind of backed off that horse. But what are your thoughts on Fauci and how wrong he's been on everything?
He's, it's a rapidly developing, virus. I think he's been right on some stuff. He's been wrong on some stuff. He could have hit the mark a little better
Yeah.
on some things, but I think overall, I do think he's done a good job. I think kind of the basic direction that we were put in by, kind of federal recommendations down to the more state mandates, laws, things like that, did save lives, did prevent the hospitals from getting overrun,
Yeah.
and did, this is really, the overall situation here is it's really a worldwide crisis. And,
Oh my gosh.
you know, if you look at, compare it to a military, campaign, war, we're at war. Did Eisenhower make mistakes and, Patton, during World War II? Yeah,
Yeah.
I'm certain of it. I'm no World War II historian, but
Right.
I'm sure MacArthur would have done things differently if, in hindsight. But we won the war, and so if any person in any profession, including myself, if you looked at every bit of my work I've done over my career, and you were looking to find something I did wrong, yeah, you'd find it.
Well,
I think that's the case with anyone. But I do have to say, I do think some of the politicalization that we're kind of talking about centers around Fauci, where one side saying, well, he's screwing up, he's doing the right thing, and the other side kind of lionizing him, saying he's the greatest mind in the world. And as with kind of what I've been saying, I think the truth is in the middle. And so you
amen
do
on
some
that.
things right, yep. Wrong, yep.
Right, exactly. And so, what do you think about what was going on with, you kept hearing these things in the news that was saying like they were just encouraged or incentivized to mark deaths as COVID because they were getting more money. What's going on there?
Who is supposedly getting more money?
The hospitals.
Yeah. So honestly, I never saw anything like that. I can't speak for every hospital. I'm not even really sure how that would happen. We, in emergency medicine, we get paid. We don't get paid differently if you have pneumonia or a heart attack, or sprain your ankle. Well, we get paid. It's not the diagnosis, it's the complexity. All right. So if you walk in, you're young and healthy, you have pneumonia, I do a chest x-ray, listen to your lungs, give you an antibiotic, you go home. I make the same as I do that I see an ankle sprain for. I do an x-ray, I put him in a splint, and he goes home. But when things get more complex, you get paid more because you're spending more time and more resources. So the hospitalized, I'm just talking hospitalized patients with COVID do tend to be more complex. But it's not just me saying they have COVID or not, would result in me getting paid more. If that
Do you
makes
think that the death numbers were right?
sense. I think if anything, they may have been lower. I think they were truly higher and may have been reflected lower in statistics. And the reason for that is, especially early on in the illness when the testing capacity wasn't there, you had a lot of deaths that may have been COVID but were unattributed. But the fact was, and at least in Massachusetts, the number of people who died in the whole state, in my state here, between mid-March and mid-April was like 120% more than the previous mid-March to mid-April. right?
Yeah.
So twice as many people died in that month period this year compared to last year. So something's going on, right?
Yeah.
Now, obviously, all those additional deaths aren't COVID. And I'll be the first to admit, certainly a good share of them was probably people who delayed care for their heart attacks and stroke and appendicitis and everything else that they were too scared to come to the hospital and get taken care of. Absolutely. But all the same, a lot more people died in this period. Now, the cause of death gets attributed X, Y, or Z. In Massachusetts, there was a certain number that were explained by COVID, certain number explained by heart attack, certain number explained by, stroke. But there was still a big chunk that was like kind of unexplained, unattributed. And some of those may have been COVID.
Okay.
You don't know. I do not think there has been egregious or nefarious like over-reporting of deaths for any like purpose or political or anything.
Okay.
Public health statistic epidemiologists, they're kind of, love your work, but they're kind of dorks, and like they're just gonna like they're numbers.
Right.
And so I don't think there was ever any purposeful over-reporting or over-diagnosing of this. Were there errors with the lack of testing in the beginning? Yeah, I mean, certainly. I can't say for sure you had COVID if I didn't have a swab to stick up your nose to test you. And then if you die a day later, I don't know, maybe it could have been. You had pneumonia,
Yeah.
Was it COVID or was it other pneumonia? Don't know.
Yeah, and this is also new, so everyone was kind of learning as they were going, obviously. At least now you guys sound like you're more prepared for if there was a second wave. But let's talk about herd immunity, because we're hearing that a lot now. As more things are opening up and people are getting out and, taking their vitamins or being healthier, do you think this will help the virus kind of
Right. So
exposed to it?
Yeah, so yes. So for your listeners who don't know what herd immunity is, it's the idea that once a certain percentage of a population has been exposed to, whether they get sick or not, has been exposed to any disease and get antibodies to it, then the whole of the population is protected because most of the people already have the antibodies. So if I'm in a crowded restaurant and 80% of the population has herd immunity, then 4 out of 5 people that I come into contact with are immune to it, so I'm less likely to get it. So that's a real thing. And pretty much in any infectious disease, in the long run, that ends up being a good thing. And the timing of when that will actually see that benefit, I couldn't say for sure. It's more on the scale of like years than like before this fall or by the end of the year. But yeah, herd immunity will definitely help. And that's why, we're a lot less likely 5 years from now to have these surges, overwhelming deaths from COVID-19. As I said before, it may be from COVID-25, fingers crossed. But yes, I think herd immunity will be helpful in the long run.
So do you think there's going to be a spike in visitations for like mental grounds from just the economics? I feel like those death rates from the economic impact from this is actually going to be far worse. What are your thoughts on that?
The mental health, behavioral health, substance abuse thing is already, we're seeing it in the emergency room. I mean, there are days where it's like, 1/3 COVID, 1/3 all the other like routine emergency medicine stuff, and 1/3 behavioral health, substance abuse, overdose. No, that's been very real. And you have people with pre-existing behavioral health issues who have not had as much access to their therapist, their support group, their AA group, and that's part of their treatment, and that's been taken away. So that's been extremely difficult on those people with kind of pre-existing issues. And then you have the new people who really never had a mental health issue before and are just freaked out and depressed and isolated. And, humans we're social mammals, we live in families and we hug and we see each other. So this has been really hard on a lot of people. Even the most level-headed, people can have trouble with it. So will the behavioral health thing be an issue? It already is. And it's already a huge problem. Substance abuse, the number of overdoses, and you get these alcoholics who have been clean for 5-10 years, and then they just go back. It's really sad. Now, what the long-term morbidity and mortality of that will be versus definitely it would be higher than if the virus was never here, but put against what if we never shut down and such like that.
Yeah.
Again, it's an interesting thing to think about. I don't really know how you could ever kind of measure that, because an alcoholic who was clean for 5 years, started drinking because of COVID, and then 2 years from now dies of cirrhosis because he started drinking again and never stopped. Is that, the causality there isn't as clear,
Right.
The argument could be, 6 months after he could have started drinking again because his wife left him, or something like that. So those are really hard. I get the concern. There's no doubt that lives have been lost because of people not seeking medical attention when they should have, because they were so scared.
Yeah.
But definitely the same is true for the behavioral health and substance abuse and such like that.
So have you guys
It's
seen
really hard on a lot of kids. We're seeing a lot more pediatric, adolescent, psychiatric issues. It's hard to not be connected to people.
Yeah. And have you seen an uptick in suicide rates and stuff?
I've personally seen an uptick in attempts. I haven't specifically looked at the statistics. I'm near certain that, 6 months from now, when you're looking at suicide statistics from this period, it will be higher. Nothing's 100%, but I would be shocked if it wasn't.
Well, because here's the thing is, as we start to reopen and people are taking more precaution and their behaviors changed and they've lost jobs and money is tight, it's that depression from just the economic fallout is going to go so much further than the COVID did.
Yeah. Oh, yeah. And I'm not an economist, but you'd have to be completely foolish to think this hasn't completely wrecked our economy, people's lives, people's jobs, people's businesses, like nothing we've seen in our lifetime, comparing it to the Great Depression. A lot of economists are, and
yeah.
And it's, a lot of people are surprised to hear this, or are surprised when they hear this, but a lot of healthcare systems, hospitals have furloughed, laid off doctors, nurses, healthcare providers, because part of this shutdown of the system was no elective, no colonoscopies. Your breast biopsy can wait a month or two. All the not emergent but required for your health kind of things that we need to do to stay healthy, and were put on hold. And so a lot of a nurse who works in the endoscopy suite, they stop doing endoscopies, gets laid off or furloughed. So it's been in the healthcare system too. Obviously on the emergency medicine thing, I feel, I'm somewhat immune to that. But all the same, at this point now, our overall volume in our emergency room is less than it was at the same time last year, despite COVID. And because what happened was pretty much everything we did for a short period was COVID. You had public health announcements and, pictures of nurses, lined up holding signs, stay home so we can, do our job, stay safe. People listened. And it has had an economic impact on the healthcare system. And again, has had a health impact on the people who didn't seek care when they were supposed to. I tell people this, last month, I do the emergency room, but I also work in a urgent care clinic, and I had a mid-50-year-old man who whose right arm he couldn't move, and it happened like 4 or 5 days before. And a reasonably healthy guy. I mean, and he didn't seem like a complete, dumbass or anything.
Yeah.
Comes into urgent care, which isn't where you should go for a stroke. You should
Right.
call 911 or go to the emergency room. And he's like, I think I had a stroke. And I examine him, and I'm like, yeah, I think you're right. This happened, 4 days ago. And I went, I'm not making the guy feel guilty, but I'm like, with stroke symptoms, you really got to call 911 and go to the hospital. These need to be treated within hours. Strokes are hours, okay? Make a difference. And he's like, well, I was so, petrified of catching corona. And I did say, I'm like, your chance of catching corona in the hospital and like dying from it or getting really sick from it are, far less than 1%. Your chance of having a paralyzed arm for the rest of your life are much, much higher than that. And so that's the thing that, we saw with some of the people avoiding care. But to your point on the economy, yeah, it's been devastating, and businesses have been closed, and careers have been ruined. Where that goes, that's going to be a big challenge, and it's part of the balance. I mean, I am, as far as like the reopening, such like that. I'm a pragmatist with this stuff. I mean, whether and I'm sure there'll be people staying locked up. If that's what you want to do, that's what you want to do. But there needs to be reopening, and I think we can do it in a smart way that both keeps people as protected as possible, but also let's do business.
So what would you say to people listening, or like a patient, like about the hospitals? Come in, is it safe, and stuff like that?
Yeah. So, speaking for emergency medicine or urgent care, you can be treated safely for whatever condition you need to be treated for. Obviously, you don't need to come to the emergency room if you have a hangnail, so like the old overuse in the emergency room.
Right.
But emergencies happen every day. People get in car accidents, and people, have heart attacks and get appendicitis, and it's safe. I mean, no place is 100% lockdown safe, but it's probably safer than your grocery store. It's probably safer than, touching a gas pump at the gas station. And we have put so much effort into our own PPE. Again, we figured out, we've gotten better at this, how to reuse it, but not just that, the operations. We've given a lot more thought to how does a patient enter? What's our flow with people? The suspected COVIDs, they're going to enter through this door, and they're going to be over here. And then there's a partition wall that's been built, right? And then the children, the pediatrics, they're going to go here, and they're going to come in this door. So your hospital emergency room is a safe place.
Okay.
And the likelihood of you suffering a severe outcome from whatever problem you're having right now is across the board a lot higher than you getting COVID in the emergency room and having a big issue with it.
Exactly. And so what would be your advice to stay healthy, especially as the economy starts to reopen and people are getting out? I think people are corona fatigued, and they're saying, F the virus, I'm out, like I can't do it. What are some things they can do to keep healthy?
It's what your mom taught you, what your primary doctor's been telling you. So the single most important thing for your immune system is,
Vitamin C?
that's a big one. That's one, but no, it's actually sleep. So you hear it over and over. You should try to get at least 8 hours of sleep a night, minimum of 7. People who get less than 7 hours of sleep on a regular basis have higher rates of obesity, hypertension, heart disease, and your immune function goes down. Your body's internal circadian rhythm with your hormones, your cortisol cycles are premised on you getting enough sleep.
Okay.
That's number one. Number two, you mentioned vitamin C. So there's certainly some vitamins and supplements that can help with viruses in particular, vitamin C being one of them. I take 3,000 milligrams a day.
You said
and a couple.
3,000?
Yeah.
I thought your body could only process like 1,000 or 500 at a time. So that's okay.
You can take it's vitamin C is a water soluble vitamin, so your body will absorb what it needs and then will excrete the rest out in your urine. So
Okay.
I like to get a little orangish yellowish tint in
So
my urine.
how much,
My body's holding on enough, and
yeah. So how much should a regular person be taking like every day? Like 1,000, 2,000, 3,000
uh,
seems like a lot.
a healthy adult can safely take 1 to 2 grams, 1,000 to 2,000 of vitamin C a day.
Okay.
Yep.
Good
Yep.
to know. Okay. So I can actually, because I was taking 1,000 milligrams and I guess I could bump it up and
Yeah, and actually, when I have a side med spa business that we do intravenous therapy at, and when we do vitamin C through the IV, we do 5,000 milligrams. So
good.
yeah, that's safe. Um, and the other two things I recommend are zinc and selenium, and those are minerals that can help with
So
immune function.
selenium, you don't hear a lot. We've been hearing about zinc a lot, but selenium is something you can take on its own or something that should be in your multivitamin.
It's probably, if you're taking a good multivitamin, it will be in there. Yeah, it's available separately in addition. So that's important too. It works with immune function. It helps block some of the cascade of biochemical reactions that happen once a virus attaches to your cells and
Okay.
starts this thing. Excuse me. So sleep, supplements, again, C, zinc, and selenium are the big ones. Diet, like you said, your mom, your PCP, eat healthy, avoid high fats, high fiber. You get a lot of vitamins and minerals, just from if you're eating a healthy, predominantly plant-based diet.
Yeah.
Um, Hydration. And it's all this boring stuff, Madison, right? Yeah.
It's
So a
yeah.
well-hydrated system is a healthier system and increases your immune function.
What
Beyond that, it's
vitamin D?
what's that?
What about vitamin D?
Vitamin D, yes, vitamin D does have some benefits to immune function. Another great benefit to vitamin D during this time period is it helps with mood,
Yeah.
depression, anxiety. And also to boot, as you may know, people may or may not know, we get our vitamin D, in our diet, but we also get vitamin D from being in the sun. Our
Mhm.
skin makes vitamin D when it's exposed to sunlight. So with a lot of us maybe spending more time indoors, vitamin D supplementation is something that we think about. Sleep, diet, hydration, and then use your own. And the whole thing with what you do with your mask or what you do if you're going to go to a store, use your own best judgment. It is obviously, if you take it to the extreme, the safest thing to do if you're worried strictly about infectious disease is to never be around people. Come on, it's not realistic. So
Right.
do it in a
Have
smart
fun.
way. I would encourage the masks in, not, I don't think if you're outdoors and you can spread out, I don't think it's required, but definitely if you're indoors, I'd recommend wearing a mask. And then beyond that, the truth of the matter is, you, me, we may have already had it and not known it, but more people will get this. More people will get this.
Okay.
Nearly all of them will be fine.
Okay.
A very small percentage that tends to be elderly and have other medical problems will not be. And that's like with a lot of other diseases in humans.
Well, it's almost a wake up call too, if you're listening, that um, this is going to be around for a long time, but you can survive and most likely will survive. But if you're not healthy and maybe you're not eating right and you're not taking the right vitamins, like use this as a wake up call to start living a healthier lifestyle. So if you do get infected, that you will be okay. So hopefully this will make us a healthier society.
I hope so, but I totally agree with your premise. Make yourself your healthiest you now.
Yeah.
A lot of us have less other stuff to do. Think about your exercise. Think about your nutrition. Think about your sleep. Think about your relationships. Think about taking care of other people. That makes you a healthier person.
Yeah.
Now's a great time to do it.
That's very well said. Well, this was great. And is there anything else you want to leave our listeners with before we let
Yeah.
you go?
This, we talked about this being, now this like war or something. This is a tremendously dramatic time in our nation, in our world, um, that we could not have imagined 6 months ago. And now here it is. And overall, there's been some tragedy. There's been a lot of difficulty, but we will be okay.
Well said. Amen. Thank you so much.
Oh, you're
Uh,
welcome.
yeah, and I appreciate it. And again, you guys, you were listening to Dr. Ciccone talk out of Massachusetts. We're very thankful for him providing the information of kind of what was going on so we can, again, form our own opinions. And as he said earlier in the interview, it is very important that you don't just watch one news source, that you look at them all and decide for yourself and do what's best for yourself. And just remember, this is not a time to be political. It's a time to be kind, and just look out for yourselves, look out for others, and we will get through this on the other side. And we'll be like, what virus? Well, probably not, but we'll all remember. But hopefully we can take some good and some positives out of this. And I thank you guys again for listening to another episode of Next to Madison. And we'll see you guys next time to find out who's next. Hi, your host, Madison Malloy here. I just wanted to remind you guys to please follow the show on social media at Next to Madison. And if you have any questions or suggestions for the show, or you feel that you would be a great guest on the show and would love to be considered, please feel free to email me at nexttomadison@gmail.com. Don't forget to subscribe to the show on all podcast platforms. And I thank you again for listening.